morning, Joan.
Good morning, Doctor. How are you today?
I'm doing great.
Good.
Good to see you today. How are you feeling about your upcoming surgery?
I'm a little, apprehensive. I'm ready to have it behind me. I'm glad I'm doing it, but I'll be glad when it's over.
Well, that is 100% normal.
Okay, good.
Every patient tells me that.
Yeah.
So before we start talking about your surgery, one of the things I need to know about you is what are the things that are most important to you, not just for the surgery, but also important that I know about you and be able to address.
Okay. Well, thanks for asking. I do really appreciate that. I guess I would say that even though I'm, a senior here, I'm still working. And so I do want to get back to work as quickly as possible. So that's really important to me. And I hike with some friends. And so I'm going to miss hiking for whatever period of time I can't do that. So I'd love to know kind of how long you would expect before I would be able to do something like that. And then lastly, I guess just like the normal activities, I'm curious about when I get to take a shower and when I can cook again and, how limited I'm going to be initially, kind of what that's going to look like would be really helpful for me to know.
Well, those are all great questions,
Mm-hmm.
and I'm going to hold you to keep me honest today and make sure that I address each one of those.
Okay.
Will you do that for
Yep,
me?
I
Okay,
will.
great. Well, next, I just wanted to answer any questions you might have about your surgery. I do have kind of a common way that I talk patients through their surgery, but I'm open to hear any questions you might immediately have about your surgery first, if you'd like to start with any questions you might have.
No, why don't you start and then I'll jump in
Okay.
if you're not answering all the things I'm thinking of in my head.
All right.
Okay.
Well, as you know, you've gotten the preoperative packet, and there's a list of things I'd like you to do, including when to stop eating and also how to take the medication prior to your surgery, and a list of physicians that I need you to see. You had mentioned that you have a cardiologist and you're treated for atrial fibrillation.
Right, yes.
Okay, so we'll be coordinating with your cardiologist about your atrial fibrillation and the medicine you take chronically for that. So I want you to also know, though, and it be clear in your mind about when we start and stop that medication.
Mm-hmm.
It never hurts to have an extra set of eyes, and you, as it is your body as a patient. So if we're not doing exactly what your cardiologist expects with that medication in the hospital, and we will have what his instructions are on that medicine. But we want you to feel free to say, hey, this is what I understood that to be.
Okay.
Okay?
Yeah.
All right, great. Well, I'd also like to talk to you about what's going to happen following your surgery. So as you know, your surgery takes about an hour and a half to do.
Okay.
And that's the amount of time you'll be in the surgical suite. And immediately after that, you'll exit the surgical suite. We'll roll you out of the room, and then we'll take you to an area called recovery. And in recovery, you're going to be monitored by the anesthesiologist. I'll stop by as well, and just to check on you briefly, but then I usually move on from that. So the people taking care of you there will be the nurse, who's very skilled in this area.
Will I be awake at that point?
You may be semi-awake.
Okay.
You're usually shortly after extubated. In other words, they take the tube out of your windpipe, and you start breathing again on your own. But it's kind of a period where we need to watch you really carefully because some of the medicines you're on can make you not breathe very deeply. You can also you're a little disoriented after that, and so we want to make sure that you don't take out your lines or interrupt your wound or things like that. So we just monitor you very carefully there. Most patients spend about 45 minutes to an hour and a half in this area.
Okay.
Although sometimes people need to stay a little longer, just to keep you safe. But after you're done with that, then we'll move you to the room where you'll be for the next day, maybe 2 days. So it's possible that you might be in the hospital for an additional day after your first day. But we'll make every opportunity to try to get you home as quickly as possible whenever it's safe for you.
Okay. So like one night in the hospital or two is what you would expect.
Two nights in the hospital is happens on occasion. I would say maybe a third of the time.
Okay.
But most of our cases go home after the first night in the hospital, so the very next day.
Okay.
So that would be total of 3 days, up to 3 days.
Okay.
If we go beyond that, then we'll have a conversation with you, because that usually means that you're recovering a little slower than we anticipated, and we may need to change things a bit just for your care. Again, this is all to keep you safe and have a good outcome, which is what I want for you, and I assume that's what you want as well.
I'm ready.
Absolutely. Okay, so during this time, after your surgery, we've just really done something that isn't normal for a body to experience. We've actually made an incision, which, if you ever cut yourself before, it hurts. And that pain is the most intense in the first 12 to 24 hours after that happens. And then your body starts to produce its own pain medicine naturally and just take care of itself. So during that time period, though, I need to use a medication that's a little stronger to try to control your pain. This is a type of medication called an opioid. Have you ever heard about a type of medicine called an opioid?
Yes, I definitely have.
What are your thoughts about opioids that you've heard?
Well, my brother-in-law has an opioid addiction due to a surgery that he had for his back, so I'm a little bit wary about it for that reason, but also I don't want to have a lot of pain after my surgery, so I guess those are my two kind of conflicting thoughts.
Okay. Well, those are. I will address the risk of addiction, which is a small risk that can happen whenever you're prescribed an opioid. But usually there are risk factors for that. And just to reassure you, we have already screened you prior to the surgery. When you came into my office, we asked you a lot of questions. And one of those questionnaires screened you for future addiction risk, and you scored very low on that. With that being said, the tool is only as good as the tool is. And so we want to be very, in the future, if you ever feel like you are craving the medication or you have to have more, or you just don't feel right without it, that would not be a normal, that would not be something normal that we would normally experience with the medicine. And I want you to always feel free that you can talk about that with me openly and without judgment. These medicines do have the potential to do that, but it is rare.
How long would you say that I would need to be on the opioid post-surgery?
So in most patients, the IV medicine will be continued for 12 to 24 hours. Although many of our patients, we just look at how the patient's feeling, and we try to get you off of that medication as soon as possible and onto other forms of medicine. Now, as a patient, you have a lot of options as ways you can treat your pain when you're in the hospital. In other words, you get to actually make the decision of how you want your pain treated when it comes to things that are non-opioid based. What I mean by that is, for example, your nurse will ask you, would you like to try another medication, an oral medicine that's a non-opioid to manage your pain? It's sometimes a misconception, but many times even hospital staff believe that if we don't give you opioids in advance, that your pain will worsen and get to a level that we then can't control. But that's not really the case. And that's why we give you a lot of the control over, you tell us how your pain is, and then we'll give you what options you might have available. And some things don't hurt you, or they might really help you, and they really have a low potential to hurt you. So those things are all on the table for you to use. So we have, for example, you can get a massage here. You can get
Sign me up.
you can get aromatherapy,
Okay.
which some people claim helps. You can we have a great audiovisual system, so you can watch great movies and things like that to take your mind off of things. We encourage your family and friends to be present in the room with you. We also immediately, we're kind of mean. We try to get you up sitting on the side of the bed, which is why we give you some medicine. But you'll need to do that with your nurse, because in the first 24 hours after surgery, you're a little weak and you may need some help getting around to go to the bathroom. But we really believe in getting you up. We're going to take the catheter that's in your bladder out as quickly as possible, usually within an hour or two after surgery. If you have had a catheter in, that's to monitor your urine output, because those things get infected and we don't want you to have that. We're going to try to get most of your IVs, your larger IVs out immediately, because they can get infected. So, and we want you to know about all the options you have. So, like I said, you have a whole host of things and we have a whole menu of things that you can try. So ice packs, heat packs, massagers, the works. So it's really quite a nice program, and our patients seem to really like it.
Well, that sounds really good to me.
You're the boss with those things. You tell us what you want to use,
Okay.
and you can try anything as long as it's on that list. Okay. So that's basically the first 24 hours. And during that time, with the opioid medication, there's a couple things that you and your family need to know about this particular class of medicines. First is that the main thing we worry about with an opioid medication is something called respiratory depression. Your body naturally takes a deep breath without you having to think about that. But opioids make that part of your brain not work as well. And in some patients, that can be a real issue for them. In fact, they may quit breathing altogether, which is not a good thing. So we will be monitoring you for that, but we also will coach your family and your friends who are in the room all the time with you that if you are not breathing in a way that they think is normal, that they should immediately alert the nurse and come get help. Okay. The second thing is that opioids cause constipation and make it difficult to have a bowel movement. So we'll start a medicine to keep your stools soft. And you need to take that for a couple days after you've stopped even taking the oral medication. So you'll continue that medicine all the way home.
Okay.
Third thing is that opioids cause nausea and vomiting in some patients. So if that happens, your nurse will talk to you about trying to get you on other alternatives to an opioid, or reducing the dose of opioid, or making sure that we give you a medicine to help you with your nausea and your vomiting. But hopefully we won't have that. But that does happen in a segment of patients. And the last one is really, even though opioids make you tired, they may cause you to wake up in the middle of the night for unexplained reasons. So if you're used to going to bed at 9 o'clock, you take an opioid and all of a sudden you're awake at 2 in the morning. So they can cause a form of insomnia, actually. And for some patients, that's alarming. The worst part of that is that we really shouldn't give you a medicine, like Ambien or another drug like that to help you sleep, because that can actually make the opioids features that make you not breathe deep worse. So we want to be careful about just treating the symptom of that. And really the cure for that is to reduce or stop the opioid and get you off of that medicine. You have a lot of different options too, and we have, Tylenol. Because of the blood thinner you're on, you're not going to be eligible for certain other medications, at least not in as high doses. But we have some other medications that can help you with your pain that you can take, and then of course you have that whole list of things that you can use as well. So again, we don't want you to be in pain, so you can take enough of the opioid medicine if you need it to help
Mm-hmm.
get your pain to the
Mm-hmm.
level where you're relatively comfortable.
Mm-hmm.
But the goal is to try to get you off of those medicines as soon as possible.
Yeah. So you would say that I would have like some pain would be okay, but not too much where like I can't sleep or it's difficult to walk or something.
Correct. Yeah. I mean, no one has no pain.
Right.
This is not a completely non-painful operation. Although the kind of operation you're having, we do in a manner so that we can try to minimize some of those things.
Okay.
But we expect you to have some discomfort. But again, as I mentioned earlier, getting you moving again,
Mm-hmm.
getting you up and walking with assistance
Mm-hmm.
until you're strong enough to do it on your own,
Mm-hmm.
sitting on the side of the bed, all those sort of things. You'll use a machine called an incentive spirometer where you take deep breaths and it has a little goal that your
Okay.
respiratory therapist or nurse will help you with. So that's a really important thing to just keep your lungs expanded and keep things moving
Okay.
and keep you feeling better. So I want to shift gears to what happens after you're discharged from the hospital. So
Okay.
after we've gotten you through this hospital stay, it's important you know what's going to happen next. So you mentioned three things that were important to you. One was the ability to get back to work as soon as possible. When could you resume your normal activities? You like to hike.
Right.
And then the third thing is what sort of activities around the house, such as showering and things like that, cooking and all those sort of things, could you start resuming? So I'm going to address each one of those as we go through that. So when you go home, we're going to send you home with a small dose of pain medication, of opioid pain medication. That's typically about 3 days worth of this medicine. Why 3 days? Well, you had mentioned earlier about addiction, and even though you're at low risk for that, it's not zero risk. There is no such thing as zero risk. But we do know from the published studies that if you use a medication, the shorter duration you use opioid medications, the less risk for a patient to develop addiction to the medicine or dependency on the medication. And have to take it all the time. And so that's why some patients never use their opioid medication. And if that happens, what we'd like you to do is just as soon as you're 3 or 4 weeks post-surgery, take those medicines to a drop box and get rid of them, because sometimes kids can get a hold of them or people will break into the house to steal them or things like that.
Sure.
When you go home, generally speaking, most patients are able to go back to work within 2 to 3 weeks.
Okay.
So you'd want to ask off for work for at least that amount of time.
Okay.
Do you need any help with that?
I think I'm okay, but I'll,
Okay.
I guess, just call the office if I need help.
We'll actually give you a note up front,
Okay.
telling your workforce so that you have that already when you go home and you don't have to call the office. You can turn that right into your HR office.
Okay.
So they have that. The second part is you mentioned when you could start hiking again. So you are having a rather large operation. And it's normal to be tired after the operation. So I would say let your body be your judge. Please don't overextend yourself, but we do want you to, take on as much initiative as you think you can. Now, for the first 3 to 4 weeks, we want to limit the amount that you're bending and stooping and lifting items over 10 pounds.
Okay.
And really don't want you doing a lot of those sort of things until that time period's up. I'll then evaluate you in the clinic.
Okay.
And we'll see where you are at that point in time and go from there.
Okay.
The other thing I want to make you aware of is if your pain starts getting worse, or you start running a fever, or you're having difficulty breathing, or you're bleeding from wounds, or you notice that your wound has something that looks like pus coming out of it, you need to let us know immediately. Please don't go to the emergency room. Please contact us immediately. Now, if you're having trouble breathing, or you're having, other symptoms which seem more severe, such as you had a seizure or anything like that, that is an emergency. You call 911 for those sort of things, and be sure to tell the ED physician that you're my surgical patient. Okay. But for anything going on with the wound or things like that, please contact us immediately. Occasionally, people need an extra pill or two, and if that happens, we will call in a couple extra pills. But because we're worried about the potential for addiction in the future, if you're needing more pills than that, then we really need to see you back in the clinic and reevaluate you. Okay. The last thing you mentioned that was important was when you could start showering and doing all those sorts of things. So in general, after the surgery, you can shower after about 3 days after the procedure. Now, how does that make you feel?
I'll survive.
Okay. We have a packet for you that tells you what you can do. So you can almost get all your body completely clean. It's just around that wound area we want to keep away from the water. And we have a way to protect the wound for you. And also we can help instruct you on how you can keep yourself clean. Is that important to you?
It is. I like a good shower.
I thought that might be.
Yeah.
And then after that, your celebratory shower.
Right.
Okay. That's pretty much all the questions and the instructions I had for you. Are there any other questions that you had?
I guess just, do you think I'll be back to 100% eventually? Would you expect a full recovery?
Right now, we are expecting a full recovery. But one of the things that we want you to do is also make sure that we have clear expectations about what the surgery can accomplish and what it can't. So, as you recall, we spent some time filling that form out where you listed what goals you wanted, and so you're going to be the judge of the success of this surgery. Everybody has a little bit different experience, but we want you to have a great outcome on this surgery. And so, yes, I'm anticipating you would meet all of your goals that you set for yourself.
Great. Thank you very much.
You bet. Thank you.
Thanks for your time.
Yes. See you next week.
Okay.